Hey, I'm back. So I was wanting to talk to you guys about the final step for our IVF procedure. Again, I just wanted to say, I think I've said it a couple of times, but everybody has a different plan and a different protocol. Not everybody, but I mean, there are different protocols depending on exactly what's going on. Like why do you guys have these infertility struggles? So often, from my understanding from my nurse, the protocol that I'm doing is frequently used for women that have PCOS. They don't always go through the testing that we're going to be doing, which I'm going to talk about. But the protocol of medications and retrieval is very much similar in most cases of PCOS. So, which is polycystic ovarian syndrome, for those of you that don't remember, which is my issue. So, I wanted to tell you about the next step. As I mentioned in the egg retrieval video, they're going to be passing the eggs directly over to the embryologist in the lab. And they're going to be pulling out those eggs, which then later that very day will be injected with sperm. One of the older standards of IVF was you put them together, you put an egg and some sperm together, and then the sperm fertilizes the egg. In our case, we're doing something called ICSI, and I think I mentioned that before, but it's a fancy name for doing a microscopic procedure of taking the sperm and directly injecting it into the egg. So the sperm doesn't have to fight. It doesn't have to do any work. It's just like, hey, here you go. Good luck with that. So that's the procedure that they'll be doing on my eggs that very day that I have the egg retrieval. And then they'll let those develop for 5 days into something called the blastocyst. And at that time, they will be doing chromosome testing. Now, the reason we have to do chromosome testing is because we've had several losses in the past. And what happens with a lot of miscarriages is that the chromosomes, there's too many or too few. With this testing, you completely avoid that situation. So you know that when you're implanting an embryo, that it has the exact amount of chromosomes that it's supposed to have. The amazing thing about that is that they can tell if they're implanting a boy or a girl, or both, or girl and a girl, or a boy and a boy. That day, they'll know the testing day. They also look at them. They have a scale that they use. I'm not a fertility specialist, so I have no idea what that scale looks like. But they have an evaluation scale to determine what the best looking embryos are, in addition to testing for the chromosomes. So what they will do is they'll evaluate that, and they will select the two best out of all of their testing. And then those are the ones that they will then implant. Now, at day 5, development for the embryos, they're not going to be implanting them for me. For some people, that would happen. For me, I'm going to have something called a frozen egg transfer, so that they will then figure out the embryo selection. They will then freeze the embryos. They freeze all of them regardless, as long as they're healthy. And then later, a couple of cycles later, they will take them and implant them. So what happens, this is kind of a newer thing from my understanding from my doctor, is that they're finding that if you allow the woman's body to return to a more hormonally natural state, meaning that you haven't been through a lot of trauma with all this stimulation, because there's a lot of side effects and your body gets, it goes through a lot of trauma with all that. They're saying that if you wait a cycle or two and you allow your body to transition back into its normal state, that when they transfer in the embryos, they have much more success rate, a much higher success rate of implantation and healthy pregnancies and healthy babies. So that's the plan. So that means that I'll have egg retrieval, and then I'll have, I think, anywhere between 4 and 8 weeks. And then I will go back and have another procedure. It is not surgical, but it's invasive. They use a catheter, and they will be, again, directly from the lab. Apparently, the embryos live 2 minutes. Or not live, but you have a 2-minute window from the laboratory to the uterus. So they pass them directly through this window from the lab and implant the embryos directly into my uterus that's been prepared for a baby. So we anticipate that happening sometime in May. Again, probably like beginning to middle of May. With that procedure, I just go in, they have me take some Valium, and they just want me to be relaxed. And then I don't know, it takes just a few minutes is my understanding. And then I have to lay there for a while, and then I am on bed rest for 2 days. And then I have really light activity after that. And then 10 days typically after that, I will go and have a blood test to see if it worked and if we are going to be parents. So that's how the second half and the final half of the process works. And that's all I have for you now. Thanks. Bye.